The governor's physicians advisory group took a break from meeting this past week to take care of their private clinics. But according to Dr. Hoa Nguyen, some of the issues that will top their agenda during the next meeting is tackling the issue of quarantine protocols, with the hope of shortening the number of days visitors will be forced to stay in the government's quarantine facility in Tumon. The current protocol is mandatory 14-day quarantine with the option of testing out on day 6, and if negative, release on day 7 to home quarantine. According to Dr. Nguyen, they're hoping to shorten that even further to at least 2 to 3 days, but it's all dependent upon what happens in the states and over the next couple of weeks.
But again, it's really depend on the surge in the U.S. or not. Because most of our passengers are from the U.S. So I think mid-January is some time frame where they expect the worst if anything happened because the holiday.
What's also key, according to Dr. Nguyen, is public health being able to stand up a firm program for home quarantine to make sure people who are released are actually staying home. Another issue to be discussed, the PAG is requesting public health to give authorization to private clinics to be able to administer the vaccines.
We've been working with all the private insurance, and CMS have approved the fee for administration for the vaccine. So hopefully during the next phase that there's about 30 clinics that also would like to offer the vaccination to their patient, that public health will release some of the vaccination to a clinic to be administered to the patient, especially the high comorbidity, because that's a capture audience when you have them in the clinic. And it's at no cost to the patient, zero cost at all.
According to Dr. Hoa, not only does it make sense for the private clinics to be allowed to administer the vaccines to their patients with comorbidities, but it's also a quicker way to get more people vaccinated. Reporting for Guam's News Network, I'm Tyler Matanani.